Hi, everyone. I'm Liz Whitehead, Managing Editor at U.S. News and World Report. Today's webinar is focused on overcoming burnout and building a health system where workers thrive. This webinar was developed with support from the National Institute for Occupational Safety and Health. I'd like to welcome now Senator Tim Kaine of Virginia, who has been a legislative leader on these issues in Congress and who will offer a few introductory remarks. Senator Kaine?
Liz, thank you, and to all who are participating in this very important CDC webinar. This topic couldn't be more important. Liz moderated a similar panel that I was on about 3 years ago, and frankly, the issues aren't getting better, they're getting more and more challenging, and that's why CDC's devotion to this topic is so very important. It's been nearly 4 years since the start of COVID-19, and it's clear that the long-term effects of the pandemic will be with us from some years to come. I remember saying a couple of years ago that the day public health officials declare the public health emergency is over, there will still be two significant ongoing consequences. One is the mental health toll that death and loss at such a massive scale has visited upon the entire global population, but particularly upon the frontline healthcare providers who had to do so very, very much. And the second ongoing consequence is folks all over the world and in this country dealing with long COVID. I'm dealing with a mild form of long COVID that I wish I didn't have, but at least it connects me with those who have much more serious problems and makes me want to work on their behalf. But the issue of healthcare, mental health well-being of our healthcare workforce is so critically important. We need a healthcare workforce to last. We have too many hospitals and other healthcare providers that are experiencing record levels of vacancy. So the first thing we should do is make sure who are those who are making up the healthcare today have the resources and the support they need. Thanks and calling somebody a hero only goes so far if you don't provide resources to help them build a long-term sustainable career. I am encouraged by some of the steps that we've worked on together to support our healthcare healers, including the passage of my bipartisan bill, the Dr. Lorna Breen Healthcare Provider Protection Act. Bipartisan, bicameral, very much focused on a much needed investment in the mental health and well-being of our frontline healers and other frontline workers. Lorna Breen, many of you know her story, a Charlottesville, Virginia native who was working in an emergency room in New York City at the front end of the pandemic when she was seeing death at an unprecedented scale, and it was still a poorly understood public health disaster that was unfolding. She got COVID. She came back to work probably too soon because she felt such a sense of responsibility for her colleagues and her patients and her mission as an emergency room physician. That led her into a significant mental health challenge, and she eventually died by suicide at the end of April 2020. But her sister Jennifer and brother-in-law Corey basically have devoted their last years to, in Lorna's honor, trying to build into our healing professions deeper awareness of mental health challenges, burnout, stress, but more importantly, what are the strategies that can be undertaken to keep people healthy and to reduce any stigma or barrier that healthcare professionals would feel in seeking help that they need. I'm pleased that President Biden signed this bill into law last year, and we've seen real progress from both private and public sectors. And today's launch of Impact Wellness Campaign is the first federal campaign to help hospital leaders improve the well-being of healthcare workers. I want to recognize so many organizations in the field who have raised awareness, who've developed solutions, who've shared best practices. And the first panel, Doctors Dearby, Farley, Howard, and Mutha, who represent some of the organizations that have really been on the front lines in trying to help us address this issue. So I want to thank everybody who's participating in today's conversation. I look forward to deriving from you the latest thinking about implementing the Breen Act, but also the next steps that we can take to make sure that we have the healthcare workforce that America needs for a long-term future. Thanks so much for being part of this today. And with that, Liz, I hand it back to you.
Thank you. Thank you very much, Senator Kaine, for providing such important context for today's discussion.